Let's talk fat grafting. Patients often ask me about fat grafting to increase breast size, and it's just not an awesome option. Here's why. First of all, there's a limit to how much fat you can transfer in any one operation, and that is because the fat needs to get blood supply. So you just can't cram it full or you'll end up with necrotic fat, which just feels like little lumps, and oil cysts, both of which show up on mammogram, can be a little bit confusing, and don't necessarily feel nice. So that's issue one. Issue two is that a lot of people just don't have that much fat if they're starting with small breasts. And again, because you're limited on the amount you can do, it usually ends up being a multi-stage procedure. So the only times I use fat grafting in the breast are for asymmetries, or like if the skin's a little thin and an implant is showing, then you can use that to thicken up the soft tissue coverage, but it's not a good option to increase size. Fat grafting can be done in the face, in the hands, other areas like that where you don't need as much fat. Those aren't things I routinely do it for. You're not going to go to the OR just to harvest fat for fat grafting of the hands when you can order a product like Renuva off the shelf. But it's not something I do a lot of, and that's why.